So my name is Sunru Yang. I'm from the U.S. originally, but I've been living in Nairobi for the past 13 years. So this is now home for us. I'm part of Dalberg, which is the leading global impact advisory firm. We have about 30 offices around the world. We're present in 10 countries here in Africa. And we bring a suite of capabilities. So we support on strategic advisory services. We provide design capabilities, research capabilities, geospatial analytics. We work on big data and machine learning. Encouraging to us is that the long-term secular trend of the continent is very promising. There's tremendous potential here. And so even as we go through these near-term challenges, we see huge promise. As countries participate in the trading of carbon credits, there's opportunity for value to flow from countries that need to mitigate what they're doing, driven by the potential for renewable energy. As this kind of value is created for Kenya or for other countries on the continent, how is that being distributed? How is that being allocated so that there's, if the government is taking a share of an Article 6.2 transaction, what's happening with that value, and is it going back into the communities and supporting those who are part of this story of generating carbon credits? There's a business case for EV, and right now where we see the business case being strongest is with two-wheelers, for the guys, for the bodas, and for public service vehicles, for buses, as you mentioned, because there's a revenue generation opportunity there. And so with EV, the upfront cost might be a little bit higher, but the total cost of ownership over the life of the vehicle tends to be lower, because electricity can be more cost efficient than using petrol. We've all seen petrol prices rise, and the cost of maintenance also comes down. I think there's a lot of opportunities to improve the healthcare system, but that can change lives in those communities. When you think, and they provide an infrastructure through which you can provide additional services. So with community health workers, sometimes they're providing one set of services. There are actually a range of things that you can now actually provide through what is essentially a delivery infrastructure to communities that are otherwise far from health clinics. I think on the primary healthcare side, this is obviously a huge priority for Kenya and many other countries. What we see there is that there's a need for more healthcare professionals. So one thing that we just need to do is make it easier for promising students to get the training that they need, get the education that they need, because the number of qualified nurses and clinical officers and doctors relative to the population is still too low.